is that they don't have a stable place to live, so they don't have access to a bathroom, clean water, things like that. We know that with wound care, we have to use very like a clean technique, right? We got to make sure that our hands are washed. So even if they have all the materials, if they're just out in the open doing their wound care, that's not a good thing. We don't necessarily want to just give antibiotics because it may not warrant that they need antibiotics, right? And we know that the overuse of antibiotics is contributing to people being less resistant to it when they actually need it. Handing out free bandages, again, is not a bad idea, but it's just that what are they going to do with it when they get it if they don't have access to water and soap to clean their hands and clean the wound? And then performing regular monitoring of the client's wound condition. You could do that, but you have to remember this is a vulnerable population, so you may not see them. So it's better to give them the offer that they can come in and do their wound changes whenever they need to, their wound dressing changes. So you guys are pretty much kind of split on that one, but the majority of you chose the right answer, so that's good. And nobody chose these, so that's good. Right, so we got a school health nurse. She's presenting a program on how to prevent teen pregnancy to a group of parents, and we want to know which comment by a parent is going to be concerning, right? So the majority of you picked this one, which is, why doesn't it not show? Here we go. My daughter is too intelligent to get involved with boys, even if her friends do sleep around, right? That's a little bit naive to say something like that, because we know that our kids sometimes they put their best face forward with us, but that may not be necessarily how they're acting when we're not around. So we need to make sure that regardless of whether or not we think that they're innocent or not, that we need to take the time to educate them and make sure that they understand about sex and how to prevent pregnancy. I can't see the other ones. Let me see. Okay, this one. I don't know why it doesn't let me see the full choice, so I can give you the rationale for that one. I've spoken to my son about birth control. He says he's not ready to be a father and support a baby. Yeah, I can't see that one. But again, this is the comment that's going to be most concerning, because it's one of those things where she's making an assumption. All right, so a mother confides to the nurse that her live-in boyfriend knocked down her 2-year-old child because he was crying too much. So that's a red flag, right? She begs the nurse not to tell anyone because her boyfriend has agreed to take anger management classes. Which of the following actions should be taken by the nurse? So we know that we have mandatory reporting that we have to do, and this is one of them. When there's a child involved, we have to report it. Regardless of whether or not he wants to take anger management classes, that's great. He can do that, but we still have to report it to the authorities. What are the other two cases where we would have to report? Who remembers? I know you guys remember, we just talked about it yesterday. What are the other two? So the answer for this one was that you would report, right? Because the boyfriend knocked over the 2-year-old child intentionally because he was crying too much, right? So we know that we have mandatory reporting laws. Reporting for abuse of children is one. What are the other two?
Older adult, in regards to like financial abuse, isn't it?
Who said something?
The older adult experiencing abuse,
Mm-hmm.
financial abuse.
Yeah, any kind of abuse, the financial abuse, physical abuse. So our elderly people, we have to report that. And then we have to also report any abuse that's being done on anybody who is disabled or have some sort of intellectual disability, regardless of their age, whether they're young or old or in between. Okay. Any questions about that one? Just remember those three because they may pop up. Okay, so Which of the following factors predisposes many migrant workers to disenfranchisement? So disenfranchisement is kind of like that feeling. You can have a lot of definitions depending on what you're talking about. In this case, it's that feeling of disconnect, right? Where you've lived in a place for such a little amount of time, you haven't really had the opportunity to lay down any roots. You don't really know how the neighborhood operates. It's kind of like, think about when you move into a new neighborhood. It kind of takes you a while to get like the hang of things and to understand, to get yourself set up, to find yourself a new doctor, find your kids a new pediatrician and all that. But they're in a community for a short length of time. And while they're there, they may not have that much time to maneuver and find these things because they're spending a lot of their time actually working. So the short length of time is what's going to be the right answer. Being a minority group member is not the right answer, just because, remember, migrant workers doesn't necessarily mean that they are a minority, and it doesn't necessarily mean that they're an immigrant. Here in Florida, that if we have migrant workers here, that may be the case just because of where we're located. The majority of the workers may be immigrant, but that may not be the case in some of the other places where we do have migrant workers. Some migrant workers are actually born here, US citizens. So it's not necessarily a person who is a minority. What else? And these aren't right either. So between these two, I see you guys were split on that, and this is going to be your best choice. All right, which of the following best describes why health professionals would be particularly concerned about the health needs of residents in rural areas, right? So your two answers are going to be a good quarter of all US residents live in rural areas. So that's a high number. That's a high number of people who are probably not getting the health care that they need. And then also a high prevalence of poverty that exists among rural families. And remember, we talked about all the challenges with being a person living in poverty. So let me see the other choices. So people in rural areas, okay, diagnoses in rural areas are usually for physical injuries, not mental health concerns. That's not correct. Remember, we talked about how mental health concerns we are concerned about mental health issues in rural communities. And the issue is that there are not enough mental health services that are being offered just because of where they're living in terms of the distance away from urban areas. And the providers that we have are limited as well. And this one says people in rural areas are especially susceptible to acute illnesses rather than chronic diseases. Remember, that's not true also. Remember that the majority of people who are living in rural areas that have illnesses are typically going to be your chronic illnesses like hypertension, diabetes, COPD, CAD, all of that. And also keep in mind, one of the things that we talked about too is that they're more likely to be the ones that are not going to be engaging in those activities that will help to prevent them from getting chronic diseases as well. But we'll review that a little later. All right, a long distance truck driver being assessed by a nurse in a community-based clinic states, I smoke 3 packs of cigarettes a day. I use coffee and diet pills from the drugstore to stay awake on the road. That makes it difficult when I do pull over, to sleep when I do pull over. So I use a prescription sleeping pill from my doctor to sleep for 4 hours. It gives me palpitations. The nurse's assessment should include a diagnosis of. So this is going to be substance abuse, right? So he's using the substance for what it's supposed to be used for, but he's overdoing it. He's doing too many things. And then it's causing him to not be able to sleep. It gives him palpitations. So now he's using drugs to correct the fact that he can't sleep. So this is more of a substance abuse. He's not going through withdrawals because he hasn't stopped taking anything. He's taking everything all at once. And it's not drug addiction because it's more of a drug dependence, if anything. He's dependent upon it for him to be able to stay awake and for him to be able to go to sleep. But it's not a drug addiction because a drug addiction is more of like a pattern of when you're just kind of like just using it just because you want to use it, even when you do not need it. In this case, he does need it, but he's overusing it. Does that make sense? Okay. All right. The harm reduction approach to substance abuse focuses on health promotion and disease prevention. A primary prevention strategy that can be used by the nurse to address substance abuse under this approach is so remember, this is a primary prevention. All right, so our answer here is to destroy the myth of good drugs versus bad drugs. So remember, we talked about that yesterday, is that we have this myth where we're saying, well, some drugs are good and some drugs are bad. And that's why we have kind of like this opioid crisis right now, where people are abusing prescription drugs because they think, oh, it's okay because it's prescribed by a doctor. But if you're misusing it, then it's still, not bad. And a lot of people don't understand the chemical component of these drugs, and they don't understand that the makeup of it can consist of some of these other drugs that are considered street drugs, but it's just made in a lab for pharmacological use. So this first one here, assess for recreational drug use, that would be an example of secondary, right? Because if we're assessing for something, that's more of a screening. If we're assessing for recreational drug use, that means that there may be potential that they've already started to use drugs. So at that point, it's not primary, because primary is us trying to stop it from even happening, trying to stop it before it even happens. Encouraging children to just say no. So remember yesterday we talked about the just say no approach is not proven to be effective. You really need to kind of sit down with kids and talk to them. And that's why destroying the myth of good versus bad drugs is a good idea, because you're actually sitting down with them and you're explaining to them and you're talking to them about it. Remember that kids are curious. So if you tell them not to do something, they're probably going to want to do it because they don't understand, well, why can't I do it? So it's better to sit down with them and explain to them and talk to them about it. And then referring to an addiction treatment program, that would actually be tertiary. Okay. So again, just to go over, the first choice is secondary. The correct answer here, this is primary. This one would also be primary, but it's just not effective. So that's probably what might have thrown you off. It is a primary approach, but it's not effective. So that's why it's not the right answer. All right, for a nurse to develop a therapeutic attitude toward the treatment of alcohol, tobacco, and other drug problems in the community, the nurse must first realize drug addiction can be successfully treated. Anyone may develop drug dependence, and any psychoactive drug can be abused, right? So remember, caffeine is a drug, alcohol is a drug, even though we may not consider them to be drugs because they are acceptable in our society to consume them within limits. They still are drugs and they can be abused. Illegal drugs are the category of abused drugs. That wouldn't be correct because we can abuse any kind of drugs, whether they're illegal or legal. Okay. A nurse in community health working in an inner city clinic with high poverty and unemployment rates recognizes the need for programs for pregnant women because these women often receive late or no prenatal care and deliver, most of you got this one right, low birth weight babies. Okay. So remember, the whole purpose for prenatal care is to make sure that the baby, you're doing good and that the baby is progressing along well, right? If they're in poverty, it's possible that their nutrition needs are not being met. If there's any kind of drug or alcohol issues going on, that could also be an issue as well. But your correct answer here is going to be low birth weight babies. At home, nothing here indicates that they're going to deliver at home. Most people deliver, in a hospital setting unless they choose to have an at-home delivery, and that requires a lot of work. You got to make sure that you get a midwife. You can't just decide that you're going to deliver at home. There's a process that you have to follow, and if you're, a high-risk delivery, then you're going to have to deliver in a hospital. All right, and our last one is for the homeless. Healthcare is usually crisis-oriented and sought in emergency departments. The most difficult challenge for nurses treating this vulnerable population is to recognize the client's limitations in following treatment protocols, right? So these limitations are because of why? They're homeless. So they may not have the money that they need. If you told them that they need to get a blood pressure monitor or something to check their blood glucose, they don't have the money to get that. Again, in the first question, we talked about wound care. If they need to do some sort of dressing change, they don't have the facilities that they need to make sure that they're doing it using clean technique. So that's your issue right there. Okay. None of these here are correct. None of these point to anything that was asked in the question. Also, aside from what the homeless person can do once they're discharged, let's talk about what we can do while we're treating them in the hospital. So we remember when we're treating someone in an emergency room, the whole purpose of us treating them there is to get them stable, right? You get them stable and then you discharge. There's going to be follow-up care that's going to be needed afterwards. That's why when you leave the emergency room, what do they tell you? Follow up with your doctor in like 2 to 3 days. If you're a homeless person, you probably don't have a primary care provider to follow up with. So you're going to try to do as much as you can do while they're there in that emergency room visit, but there's going to be a lot of limitations because most of the things that need to be done in a primary care setting. Okay. Anybody have any questions about any of these? Okay. So now we're going to do a little review of some stuff that we talked about in the first week, just to give you a refresher so you don't forget it, because it's going to come back up on your exams. Even though the majority of your exam is going to be on vulnerable populations, you know that community assessment is something that you're going to be doing throughout, right? So
records, anything that you can see on data. It's basically data. You're not getting it from the person or the people in the community.
Perfect. And that's where you're going to get that statistical data, that 50% of XYZ, you know, your mortality rates, like you said, your health records, all of that. It's going to come from there. Good. All right. So when you're doing your interviews, remember you have a key informant, right? So you have your formal and you have your informal, right? So your formal, remember, those are the people that may have a title or position. They might be a police officer, a doctor, a teacher, a mayor, or something like that in the community. And then you have your informal. Those are people that may not necessarily have a title, but they're usually outspoken. They know what's going on in the community, right? And then again, we already said that the goal to speak with people is to collect non-statistical data, right? So if ever you see that, remember that, okay? So now let's talk about vulnerable populations. What is a vulnerable population? What does that mean to be vulnerable? What's the key word I'm looking for?
Like they're disadvantaged, people who are at a disadvantage, populations that are at a disadvantage. So it's like you're homeless, you're older adults, pregnant adolescents, single parent families, especially if it's led by a woman.
Right. So these are people that the word I'm looking for, disadvantage works good, but at risk. These are the people that are at risk for adverse effects, right? So if we're all, for example, we're all faced with COVID right now, right? But people who are considered vulnerable, we anticipate that they're not going to do so well if they're exposed to COVID. Their outcomes are going to be worse when you compare them to people of the general population, right? So think about people who are homeless, right? We're telling people to quarantine, to stay indoors, to wear masks. If you're homeless, you can't do that. You may not have access to get a mask. You don't have access to clean water and soap. You don't have hand sanitizer. You don't have anything to help, put a barrier between you and coronavirus. So that's a perfect example of how people who are considered to be vulnerable populations are at higher risk when we compare them to people of the general population. All right. What about rural areas? What is a rural area? What does that mean to live in a rural area?
Away from the big cities and away from the main healthcare big facilities like hospitals and clinics with
Hmm.
specialists.
So about how many people live in rural areas? What's a average? Mm-hmm. Mm-hmm. Right. Right. And they live far away from the urban areas. They're called usually farmland. What about the people who live there? What are some characteristics about them? What racial group are they mostly from? Their education, their marital status. What about them? What do we remember?
Marital status, they're either, I think it was married or widowed.
Hmm.
What else did you ask?
Racial group.
Racial group.
Primarily Hispanic.
I think it was like older, wasn't it? Like what group? It was like older adults. I think it was younger than 18 or older than 65. If
Yeah,
I'm not
so it's
mistaken.
like
I think that was in Stanhope.
yeah, it's like young and then very old. It's
Right.
usually more a higher proportion of white people. So it's like less culturally diverse. And that's one of the reasons why, especially when we talk about rural areas, we try to promote cultural diversity, particularly although it's mostly white, you do still have a lot of, some cultural ethnic people there that we need to make sure that we're providing culturally diverse and linguistic care to, right? So we don't want to ignore the fact that there may be some people there that need that. So let me just pull this up, just go over some proportion of whites, higher than average numbers of younger and older residents, like you said, more likely to be married or widow. They typically have fewer years of formal education. How do you think that affects their health literacy?
They, yeah, and they're very important as well as someone who knows how to read or has understanding.
Mhm. Right. We would overlook that because we wouldn't think that was an issue. But it could be, so that's why it's very important when we provide them with the instruction, even when we speak to them. So avoid things like medical jargon, don't use technical language, just be as simple with your explanation as possible. And again, the written instructions, make sure it's no more than a fifth, sixth grade reading level. And then they're also at higher risk of underinsured or uninsured. And that creates a problem with their health care as well. All right. Tell me about migrant workers. What's the difference between a migrant worker and a seasonal worker?
Migrant workers usually have a job year round, and seasonal workers sometimes during the season, and it's very rare for them to like move. Like there's some that move, but some of them don't. Like they wake up and leave for a job. They just wait for the season to come around.
Okay, so I hear you about seasonal. What did you say about the migrant worker? You said that it's
They're usually workers who have a job all year round.
okay. All right. So there's bits and pieces there. So I'll start with migrant workers. So migrant workers, as the name suggests, they move around from place to place in order to work. Because of that, there's not much job security. So once the job is finished, then they have to move to another area for work. And sometimes work is not necessarily guaranteed. Sometimes housing is not necessarily guaranteed. But that's my migrant worker. Now the seasonal worker, they're similar to migrant worker. They are employed in agriculture, but they have a permanent residence, right? They live somewhere permanently. And then they usually have like another job that they work at full time permanently, but they'll pick up seasonal jobs as they come along in that area. So think about during the holidays, right? This is an example that I like to give. I hope it helps. That when the holidays come around, a lot of these larger stores like Target, Walmart, and even bigger stores than that, they're looking for seasonal workers, right? To fill in a need for the holiday season, because they know that there's going to be a lot of shopping. There's going to be a lot of shopping, and they're going to need extra workers in the stores. So they'll hire them from around like a little bit before Thanksgiving until a little bit after the New Year to meet that demand that they're going to have. So usually people who pick up seasonal jobs, they live in the area, they have another job, but they pick up those extra hours just to make a little bit more money. So those are the two differences between migrant and seasonal workers. Everybody get that? So you might want to screenshot this right here. So they're both employed in agriculture. But the migrant worker living arrangements are temporary, they move from place to place. Seasonal workers employed in agriculture, but they likely have a job as well, and they permanently live in that one place. All right, tell me some barriers that migrant workers might face. Mhm. Mhm.
They don't have the means to take healthcare sometimes.
Or health insurance.
Mhm.
And
Right.
yeah. Or sometimes like their bosses told them you can't afford more than this amount of money days and we're gonna let you go. So they have no other choice but to work and not attend to their needs.
Yeah. There's a lot of stuff that happens that shouldn't. And this is not every farm that does that. You have some farms that are, they treat their workers well. But you have some farms that definitely take advantage, especially if they know that the workers are undocumented. They'll force them to work long hours, and and as a result of that, they end up neglecting their care. Another thing we didn't talk about too was the children of migrant workers. They are allowed to work on the farms with the families. I think as early, I want to say as early as 12. I think it might be younger than that, but I believe that might be the age. And then we have to think about some of the health concerns that are related to that. When we talk about, remember, pesticides, exposure being an issue for migrant workers, think about how that can affect children. If it affects adults, it's going to affect children to a greater degree. What else? The incidence of TB. Remember, TB is spread when people are living in close, crowded conditions, and that happens often in migrant housing because some of the conditions are not the best. Sometimes there's not enough housing available, and families are kind of forced to live together in smaller areas. Okay. Tell me some key things that we need to know about the homeless population in terms of how they get health care and things like that. Mhm. 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 And when we do see them, what kind of care should we give? What's the word I'm looking for? You want to give comprehensive care because we don't know when we may see them again. So we want to try to address as many concerns as possible. In the ER, sometimes that's not practical, because ER, like I said, is meant to stabilize the patient, discharge them so they can see their primary care provider. But at Jackson, they have some programs, like they have a J11 card that they give out for people who meet certain requirements. Like if they're indigent, remember people who are stricken with poverty or homeless, for them to get follow-up. All right, teenage pregnancy. Let's talk about teenagers. What are some special issues that they face that's unique to them as a teenager, opposed to an older woman who's pregnant? What are some issues that they face? Mm-hmm. Right. Mm-hmm. Right. Their eating habits are probably not the best. As a teenager, they typically like to eat foods that are not very nutritious. And now they have a baby growing inside of them that's going to require, specific nutrition, as well as they're still developing themselves, so that presents an issue. They're at risk for having babies of low birth weight because of that. They're also at risk for violence. For some reason, their partners seem to be violent with them when they become pregnant. For some reason, teenage girls are more at risk for violence than adult women. Then there comes the issue of infant care. Who's going to take care of the baby once the baby gets here, especially if she decides that she wants to go back to school. So I know when I was in school, they had a school for pregnant girls and they could bring their babies with them. I don't know if that's still a program that's here in South Florida or not.
Yes, they still have it. It's called COPE.
Yes, COPE. Yeah, it actually was like right across the street from my school. So that's something that is an option for them. But you have some girls who choose not to go back because of the shame and embarrassment that they feel, from becoming pregnant at an early age. But at least that is a resource that is available to them. And then when we find out that they're pregnant, right, what do we want to make sure that they're getting as soon as possible? Right, because it's likely when we find out, they've probably been hiding it. They may be like 5, 6, 7 months along, and way overdue for some prenatal care. So we want to make sure that they get that as soon as possible. Mm-hmm. 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 Yeah. And that speaks to also, when it comes to like the religious aspect, we don't want to talk to kids about sex and give them options. We tell them that, abstinence is the only way, when really we know that we can't be with them all the time. So the only thing we can teach them is safer sex, because there's no such thing as safe sex, 100% safe sex. Teach them about safer sex, and how they can prevent pregnancies. If they choose to be, not every, girl or boy is going to want to engage in sexual activity. And of course there's a lot of teenagers out there that do abstain from sex, but you want to give options, because otherwise then we have issues of teenage pregnancy when it could have been prevented with education. And then finally, our last slide is on substance abuse. So tell me what you guys remember from yesterday about substance abuse. Anything? Mhm. Yeah, it happened. It did. Mhm. It does happen. We do have issues too where parents will bring their kids in intentionally to, and say that their kid has ADHD or they think their kid has ADHD because they want them to get medications to help them with their study. Yeah. So yeah, parents will help, those parents that are kind of, overachieving and put a lot of pressure on the kids, they will sometimes do that. Yeah. What about drug dependence and drug addiction? What's the difference between the two?
Dependence, your body needs it.
Mm-hmm. So it's right. So your body needs it. So you're not taking it because you just want to. You're taking it because your body is telling you that you need it. Maybe you've built up a tolerance because this is a chronic issue that you've had for some time. It is a form of drug abuse, but it's still not at the drug addiction level yet. And when we get to drug addiction, this is where we're talking about it's a pattern, right? Where it's like, I have to have it, I need it, I'll spend my last rent money to get it, I'll do whatever it takes just to go ahead and get it. What about withdrawal? What are some symptoms of withdrawal?
It could be a headache, tremors, nausea, sweating.
Yeah. It could be as simple as like the sweating and things like that. And it can it can get as bad as seizures and hallucinations, like you said, which it can present a dangerous situation. So this is why you have like detox centers where people can go and safely detox and be monitored when they're trying to get off of certain drugs. What else? I think that's pretty much it. As long as you understand dependence, addiction, withdrawal. What about genetics? You think that genetics can play a factor? Yeah, it's not 100%, but it can play a factor because we do see where alcoholism and drug abuse, it does run in families. So it can be that once you have some people where they're exposed to drugs and they start it, and for whatever reason, they can get off of it. Not easy, but they do it. And then there are those people who are just like, they can't kick it no matter how hard they try. So that's when you start looking at that genetic component. Okay. Anybody have any questions? All right, so the practice quiz is there if you want to take it again, just to do better. What else? I'll post a review on Tuesday. So once you guys have done all your studying and everything, I'll give you a review that you can just listen to and kind of solidify everything that you've already studied and everything that we went over. All right, do your questions, because remember, your questions are going to help you with the exam. They're basically your study guide. So if you're studying your questions, reading your book, doing the practice quizzes, you should do fine. Okay, if you have any questions while you're studying, just send me a message. All right.
Okay, thank you.
You're welcome.